Across the globe, there are staggering figures coming out in relation to the coronavirus. In India, the number of cases now stands at more than 1 million due to the tally of new infections and deaths, both hitting a daily record. And that has led to new lockdowns being imposed in a number of states across the country as authorities try to get the situation under control. Let's show you Brazil. There have now been more than 2 million confirmed cases there. That's the second highest number of cases in the world. More than 74,000 people have died with the virus there, and due to a lack of testing being carried out, the true figure is believed to be even higher. The US, which already has the highest confirmed number of cases, the daily record for infections was shattered on Thursday with more than 78,000 new cases. So let's take you to India first, which has now become the third country in the world to pass the 1 million mark. India more densely populated than the US and Brazil, so the fear is that transmission rates could continue to climb. Let's talk now to Zabir Ahmed, who joins us now from Delhi. Zabir, where are the hotspots? It's no longer just the cities, is it?
Yeah, exactly. The earlier hotspots were the financial capital, Mumbai, the Indian capital, Delhi, Maharashtra state, and states like Gujarat and Tamil Nadu. They continue to be critical, but we've got new hotspots. Like we have smaller states, smaller towns and cities which are now under lockdown all over again. Bihar, Jharkhand, Karnataka, and Goa are badly affected places. I mean, some of the places are not even on the radar of the Indian media. For example, take my own hometown, which is a small city in India, which had not reported a single coronavirus case during the first lockdown after the end of March. But now it is under complete lockdown for the last 3 days because of the fresh cases that have emerged, that have been reported from there. So, but nobody's talking about it. So there are several other small towns and villages and states which are not on the radar of the media, but the coronavirus is spreading in those places.
So, Zabir, that lack of reporting, in a way, that you're talking about, the lack of attention on certain places, would that go part of the way to explain why the death toll, the official death toll, is so low?
Well, the official death toll is the right term to use because it is a very controversial thing here in India. Many people believe, doctors have told us, that many deaths are not being reported by the state government authorities under COVID-19 cases. As I must say to our audience that health is a state subject in India, and every state government is responsible for collecting data on COVID-19 deaths and coronavirus cases. And in many cases, it's been found that the numbers reported were inaccurate. So, of course, many people believe the number could be much higher, the number of deaths, but officially it is only about 26,000.
Zabir, thanks so much for joining us. The view there for you from India, the world's third most affected countries. Well, second is Brazil, with more than 2 million people now confirmed to have had COVID-19. The number of people who have died from the virus risen now to almost 77,000. Katie Watson has more from Sao Paulo.
In these frightening times, moments of comfort are everything. For 2 months now, this man has been in intensive care. He only has one working lung. It's unclear if he'll survive. Dr. Andre asks if he's experiencing pain. All he can do is blink to say yes. These are intense times for everyone. Andre works on shift with his wife, Dr. Fernanda. They live this crisis together 24/7. Even here, Brazil's top infectious diseases hospital, coronavirus has floored them. It was the first hospital to fill up in Sao Paulo, and every day they're turning more people away.
It's not physical, it's psychological, because sometimes we fail and we have to deal with the family pain, and they just couldn't see those patients. They're not here for them when they're dying. It's about the loneliness that they feel, even they are sedated. I feel safe here, more than I'm outside. Really?
It's a comment that says a lot. The president has shunned social distancing and regularly refused to wear masks, despite them being mandatory. The death toll keeps climbing, and even now that he has the virus, he's supportive of shops and restaurants reopening. There's little love for Jair Bolsonaro on this ward.
I think he was the worst thing that we can have in this moment. He is, in fact, irresponsible. He is a person without empathy, and he said, "It's not my problem." So, it's my problem?
In the midst of grief, politics doesn't matter, but everyone's affected.
Gravediggers tell me that their work has tripled. No longer do you have hearses bringing in a body, you have vans bringing in 5. People often say that this virus is invisible, but the suffering here is so easy to see.
I meet Adam Nielsen in Latin America's largest cemetery. He's exhuming bodies today. With burials rising, space is at a premium. So those whose loved ones died more than 3.5 years ago are being asked to collect their bones. The only thing a gravedigger's afraid of is getting COVID, he says. He's been in the job for 25 years. His hours are long, and it's got personal. His uncle was buried here just a few weeks ago. A childhood friend was also lost to Covid-19. Adam Nielsen says his job nowadays is also that of a counsellor, telling families to stay home and stay safe. If people here understood the point of quarantine, we wouldn't be so busy, says Adam Nielsen. Things would be different. For those who've passed, little chance to rest in peace in these challenging times. Katie Watson, BBC News in Sao Paulo.